Hello, my name is Brad Sorensen. I'm a student at Grossmont College, respiratory therapy student. Today we're going to be doing a tracheostomy care and cleaning of a patient. And the first thing that I want to do is I want to wash my hands for at least 15 seconds. The most important thing that we can do as respiratory therapists is to be to take the time to do proper infection control. So then I've washed my hands off, got them nice and lathered. Go ahead and dry my hands off with a clean towel. Great, now I'm going to grab some gloves. We want to make this as clean of a procedure as possible. And we're going to head over to our supplies, and I'm going to go over what supplies we'll need for today. I've washed my hands properly. And now we're going to go over the different equipment we'll need to properly change out this inner cannula and provide trach care to this patient today. The first thing that we want is a trach care set standard. It comes with 4 gauzes, 4 pipe cleaners, 2 cotton tip applicators, 1 trach brush, 1 towel, 1 tilt tape, 1 trach dressing, and 1 pair of powder-free vinyl gloves. And next we'll want some sterile water. This is the first stage. Our second stage of our trach inner cannula will go through the sterile water. And our first stage will be the hydrogen peroxide. We're going to clean the inner cannula with the hydrogen peroxide, and then we're going to let the inner cannula sit in the sterile saline, and then we're going to place it on a dry napkin to let it dry. So the first thing that we're going to want to do is we're going to want to go over to our patient and look at the current setup and see what needs to be changed. Welcome back. Now that we have our supplies set up next to our patient, we're going to go ahead and prep everything for the procedure. First thing we're going to do is we're going to go ahead and open up our sterile water and our hydrogen peroxide. Go ahead and put my sterile water into the tray. Go ahead and empty my hydrogen peroxide to the first tray. So just to recap, we're doing hydrogen peroxide for the first container. The second container is sterile water. And the third container, which I just added, is where we're going to let the inner cannula dry after we've put it through the first 2 steps. Next thing we're going to do is we're going to open our trach care kit. And we're going to try and keep this as sterile as possible. I'm going to go ahead and get my pair of gloves out here. Okay, I'm double gloved up. Now I have the sterile gloves on over the first pair of gloves I put on, so I'm double gloved. So I'm going to go ahead and get the rest of my kit out. So I have my pipe cleaners. I have my 2 Q-tips. Then I have my little trach brush here. And I have my new set of gauzes, because I'm gonna want to change my gauze out. And then I also have another tie if I want to retie my new I want to retie my trach tube on. So I'm just going to go ahead and get started now. The first thing you want to do is so the first thing you want to do is you want to suction your patient. You want to get all the secretions out. So if I was to start this out, the first thing I would do is suction. Next thing I'm going to do is I'm going to remove my inner cannula. Go ahead and turn that counterclockwise. I'm going to go ahead and put it into my hydrogen peroxide. And I'm going to start scrubbing it on the outside. Get the outside.
Oh, goodness. Did you finish with Simon?
And I'm going to go ahead and clean the inside. Oh, we're shooting a video.
Sorry.
You want to redo that? Okay. Now that I have that cleaned out, I'm going to go ahead and let it sit in my sterile water. And if I had a new inner cannula out of the bag, a disposable one, I would just put that one in now. And once it's sat in the sterile water, I'm going to let it air dry in the third container. Next thing I'm going to do is I would apply a saline or of some sort to loosen up the gauze, because the gauze might have been kind of stuck to the skin from the secretions. So I would do that, and then once I've gotten that moistened up, I'm going to go ahead and take out the gauze. And I'm going to throw it away. And now what I'm going to do is I'm going to clean around the trach tube. So what I'm going to do is I'm going to get my hydrogen peroxide. I'm just going to dip it in the hydrogen peroxide. And I'm going to go around the inner cannula, upward stroke. Sorry, you actually use the Q-tips. And I'm just going to do one stroke. All around this inner cannula. We want to get it as clean as possible. So the next thing that we're going to do is we're going to replace the gauze. Great, now that we have our new bandage in place, or our new gauze, the next thing we can do is we can change our strap. So what you can do is, we'll go ahead and undo this. We're going to hold the trach steady as we do this. So if I was putting on a new strap, I would keep this old strap on and I would go ahead and disconnect it, and then I would connect the new strap and hold the trach tube steady as I'm doing this. I'm just going to thread it through this. Some of these trach tubes are flexible. This one doesn't seem to be. Now that I've held this trach tube steady, I'm going to want to tighten it to one finger. I want to be able to fit one finger in there. So I'm going to go ahead and tighten that down. It's good. It's at about one finger. So now we've changed the trach tube. Now that our inner cannula has dried, we're going to go ahead and replace. We're going to put our inner cannula back in. And we're going to tighten it. You'll see there's two dots. One on the inner cannula and one on the trach tube. You're going to want those dots to line up. That's how you know you've put it in properly. Now that we've replaced the inner cannula, we've cleaned the inner cannula, we've cleaned around the trach tube and the stoma, and we replaced the bandage, we have now finished our session of trach care maintenance. Thanks for joining us for this, and we'll see you again.